Hey everybody, welcome to another episode of the Bitter Pill. So, I apologize for the uh, long length of the previous video about uh, vaccine efficacy. If you had a chance to watch that, I had originally intended on making a very succinct video, just basically conveying again and adding some information to uh, material that I presented in an earlier, much longer video on mandates, but I kind of went overboard and, I tend to run on, so it was almost an hour. So I'm going to try to keep this video a lot shorter. And what I want to talk about today is a recent article and video that Glenn Greenwald made, where he makes the claim, as you can see from my, let me just show you. Uh, he makes the claim that people are refusing to apply cost benefit analysis to discussing what policies we should be pursuing with respect to controlling the COVID pandemic. That's his claim. Uh, and as you can see from the title there, I don't agree at all that he did a good job of uh, you know, looking at the costs and benefits of various COVID policies for reasons that I'll get into in detail. Um, First of all, he makes a terrible analogy between uh, COVID um, policies for trying to mitigate the consequences of the COVID pandemic, and policy regarding cars, trying to mitigate whatever uh, costs, such as highway traffic deaths and so forth, are incurred as a result of using cars as a mode of transportation. And it just doesn't work because it's like he doesn't understand that we're talking about a completely different animal. With COVID, we're talking about a highly contagious disease. And he gets a number of other things wrong as we'll get into. Now, I just want to stress, I like Glenn Greenwald. I think he's a great journalist. I really value his work on many issues that he's covered. His coverage of Eric Snowden's work in uncovering how we are all spied on and how that all works, which won him a Pulitzer Prize, very deservedly so. His reporting on the Russiagate scam that our government tried to pull on us, convincing us that somehow Russian interference was to blame for Donald Trump beating Hillary Clinton, or at least partially so, and that Trump and the Russians conspired together somehow, which was ludicrous all along. And Glenn, among a small handful of journalists, saw through it and reported on it quite painstakingly. He really dug deep into the story. He's been very fair to people like Julian Assange and Tulsi Gabbard, who have been relentlessly smeared by the corporate media and politicians and others, including writers at his own outlet until recently, The Intercept. He's done very courageous reporting on Brazil, uncovering massive corruption there, in spite of threats to jail him based on very similar a very similar angle, a very similar approach to what was used to throw Julian Assange in jail and try to prosecute him. He's also done great reporting on the cruelty and corruption of animal agriculture, and I appreciate, since I'm one as well, that he's a vegan and supports animal rights. But his take on COVID has often been, to be honest, shockingly ill informed and not at all reflective of his usual diligence as a journalist. Um, so, I want to take a close look at his attempt at cost-benefit analysis on measures taken to prevent negative outcomes from COVID. Um, so, so let's take a look at the article that he wrote about this. I'm not going to show you the video because that would take much too long. Um, but he says, in virtually every realm of public policy, Americans embrace policies which they know will kill people, sometimes large numbers of people. They do so not because they are psychopaths, but because they are rational. They assess that those deaths that will inevitably result from the policies they support are worth it in exchange for the benefits these policies provide. This rational cost-benefit analysis, even when not expressed in such explicit or crude terms, is foundational to public policy debates, except when it comes to COVID, where it has been bizarrely declared off limits. The quickest and most guaranteed way to save hundreds of thousands of lives with policy changes would be to ban the use of automobiles or severely restrict their usage to those authorized by the state on the ground of essential need, or at least lower the national speed limit to 25 miles per hour. Any of these policies would immediately prevent huge numbers of human beings from dying. Well, I mean, the first problem I have here is that he's assuming that the average American, or even like journalists or whatever, have some significant influence on policy, and that the reason why we have tens of thousands of deaths in the United States from auto accidents every year is that people agree with this policy that the United States has of relying primarily on automobiles for personal transportation and trucks for shipping freight and so forth. Well, this isn't a policy that you or I decided on. This was a policy decided on by the U.S. government in collaboration with corporations that had great influence over the government, such as oil companies and auto companies and so on and so forth. Well, a topic for another time. But let's go on. Given how many deaths and serious injuries would be prevented, why is nobody clamoring for a ban on cars, or at least severe restrictions on who can drive or how fast? Is it because most people are just sociopaths who do not care about the huge number of lives lost by the driving policies they support? Blah, blah, blah. Well, no. It's because, I mean, if we have to commute for work, for example, I don't, but I used to, and there were times in my life when I had to commute a long distance to school or work or what have you. If I had my choice, I wouldn't do that, and so now I've chosen to work from home. If I had a choice, if I lived a considerable distance from my job and I had that choice, I'd take mass transit. If I lived in China, let's say, I'd be able to take a train most anywhere I wanted to get there quickly and easily. But that's not the transportation system we have in the United States, and we don't really have much say in it. So he says, we employ a rational framework of cost-benefit analysis, and we examine both the side of the ledger involving how many people die if cars are permitted, but also consider the costs generated by policies that would prevent those deaths, such as limits on our ability to travel, major restrictions on the speed limits, and the financial costs of just giving up cars entirely. Well, that's a false dilemma, right? Because obviously we could have a different transportation policy. But He says, while arguments are common about how this framework should be applied and which specific policies are ideal, the use of cost-benefit analysis as a primary formula we use is uncontroversial. At least it was until the COVID pandemic began. It is now extremely common in Western democracies for large fractions of citizens to demand that any measures undertaken to prevent COVID deaths are vital, regardless of the costs imposed by those policies. Thus, this mentality insists we must keep schools closed to avoid the contracting by children of COVID, regardless of the horrific costs which 18 months or 2 years of school closures impose on all children. Well, we haven't had the COVID pandemic for 2 years, Glenn, so it obviously hasn't been 2 years. But anyway, I don't know about where you are, but where I live, schools have certainly not been closed for anything remotely approaching 18 months. And certainly there are considerable differences of opinion among parents who have kids in school about whether or not in-person schooling should be open while we have a raging pandemic. So he goes on to say it's impossible to overstate the costs imposed on children of all ages from the sustained, enduring, and severe disruptions to their lives justified in the name of COVID. Entire books can be written, and almost certainly will be, on the multiple levels of damage children are sustaining, some of which, particularly the long-term ones, are unknowable. Long-term harms from virtually every aspect of COVID policies, including COVID itself, which, as I've already implied, he gives short shrift to those consequences. The vaccines, isolation measures are by definition unknown. But what we know for certain is that the harms to children from anti-COVID measures are severe and multi-pronged, or so he claims. One of the best mainstream news accounts documenting these costs was the January 2021 BBC article headlined, COVID, the devastating toll of the pandemic on children. The devastating toll referenced by the article is not the death count from COVID for children, which even in the world of the Delta variant remains vanishingly small. A few hundred people in the United States since the start of the pandemic. So they say that the harms that have come from the policies enacted to prevent the spread of COVID on children include supposedly increasing rates of mental health problems, concerns about rising levels of abuse and neglect, potential harm being done to the development of babies. Not sure what that's about. The closure of schools is, of course, damaging the children's education, but schools are not just a place for learning. They are places where kids socialize, develop emotionally, and for some, a refuge from troubled family life. Yes, as I'm sure those of you out there listening who are parents know, kids can't socialize with other kids except at school, right? I mean, they never, hang out with other kids unless they're at school. Sarcasm there. When we close schools, we close their lives, said Professor Russell Viner, president of the Royal College of Pediatrics and Child Health. Okay, so, and then, he interviewed a couple of mental health experts back in April of last year about, the devastating toll of the COVID pandemic on children, etc. I'm not going to go through the whole article, but he says here toward the end, whatever is true about motives, what is unacceptable, sociopathic really, is the insistence on assigning severe costs to just one side of the ledger, harms from COVID itself, while categorically refusing to recognize, let alone value the costs on the other side of the ledger, from severe enduring anti-COVID disruptions to and restrictions on life. You kind of trailed off there, Well, the first problem with his analysis, obviously, as I mentioned, is that, he's failing to account for the fact that this is a highly contagious disease, and we're now in a phase of the pandemic with the prevalence of the Delta variant, where COVID is twice as contagious, more than twice as contagious, perhaps, as the original variant of the virus. We're not just talking about consequences to kids themselves of putting them in a situation in schools where very often it's the case that There's no mask mandate in place, or even active opposition to kids wearing masks. So in many cases, kids and teachers, very few of them are wearing masks. They're in a crowded and often poorly ventilated space. 30 plus kids crammed into a classroom quite often, sitting very close together. Uh, and we've already seen many cases since this push to open in-person schooling back up, where in most places in the United States you don't even have an option anymore to have online learning. That's not even an option. Either you go to school in person, or send your kids to school in person, or you're they're truant or whatever. Um, and this has already, we've already seen that this has resulted in an enormous rate of infection on school students, as well as teachers and other staff. That's thought to be, according to research that was done on it, really the major factor that drove the first wave of the Delta variant in the UK, where they went from having very few cases and almost no deaths of COVID due to not only their extensive vaccination campaign, which wound up vaccinating more than 60% of the British population, but also a approximately 4-month long lockdown that took place in the UK during the first part of the year to cope with the extremely high rate of COVID cases and deaths that was occurring in the UK, as well as much of the rest of the developed world early in the year, over the winter. So they got through that crisis successfully by locking down, closing schools, controlling borders, testing and contact tracing, as well as a massive vaccination campaign, down to the point where they had really almost no cases in early May. And then they started opening things back up. They were sending kids back to school, and kaboom, before you know it, the Delta variant hit the UK, and their cases started to skyrocket again, quite significantly due to the return of kids to school, who in turn would infect their parents or other people they encountered. So, with the contagiousness of the Delta variant, where, it's more than twice as contagious as original COVID, more contagious than most other infectious diseases, not quite, but almost as contagious as chickenpox. If you put people in a situation where there's next to no mitigation, including kids in the UK, almost none of whom are vaccinated, not only since the pharmaceutical companies haven't, or regulatory agencies haven't authorized COVID vaccines to be taken by kids under 12 at all. In the UK in particular, they're not vaccinating anyone under 16. So the overwhelming majority of kids are unvaccinated. Many teachers are not. Hardly any school districts have mask mandates. Crowded schools, etc. An utter disaster. So that's the first thing wrong, is he's not accounting for the high contagion associated with sending kids back to school, where, they're bringing the disease home and infecting their parents, or, even in some cases, if their parents are vaccinated, of course, they can have a breakthrough case, particularly if it's been a long time since they've been vaccinated, infecting other relatives, perhaps their grandparents, friends, family, etc. Not a good situation. He's also harping on deaths from COVID and saying, well, look, hardly any kids die of COVID. Well, that's true, Glenn, but what about other negative consequences to kids if they get COVID. Um, sure, many kids have a very mild case of COVID. It's kind of like the flu or a bad cold for them, or maybe not even that. Maybe maybe they have an asymptomatic case, but there's not an insignificant number of kids who can get more seriously ill from COVID. We have thousands and thousands of kids in the United States in the hospital right now. I don't have any figures off the top of my head, but I think the overall hospitalization rate in the United States the other day passed 100,000 people in the hospital at this time in the U.S. And if I'm not mistaken, around 10,000 of them, something like that, were children. Um, you don't quote me on that figure, but I know it's in the thousands. So there are kids getting seriously ill with COVID, even if they don't die. But some of them are dying. And so, what are you going to tell their parents if you encounter them, Glenn, that they should suck it up because cost-benefit analysis says that sending kids back to school in the middle of a raging pandemic of the most contagious, deadly virus the world has seen in over 100 years. Your cost-benefit analysis says their kids' deaths are worth it. I don't think they'd agree with you. And again, it's not just the deaths, but many times as many kids get seriously ill as die. And also, Glenn's not taking into account the toll of long COVID, where on the one hand, there's tens of thousands of kids who've gotten seriously ill from COVID over the course of the pandemic. There are most likely somewhere in the millions of kids who have long-term negative consequences from COVID. I'm not sure if they put an exact number on it, but it's estimated between 3 and 12% of kids is an estimate that I heard recently who are infected with COVID. Even if they get a mild case, this can happen. They have long-term debilitating symptoms of COVID. They can have damage to various bodily organs, their lungs, their heart, their brain. There's often brain damage with long COVID. So, this is really not something to take lightly. Again, I'm not sure about the numbers, but it's a lot of children who are suffering with that. And, just in general, the more spread of the virus we have, the more likely we are to have more lockdowns, people being laid off from work because it's too dangerous. And, in the United States especially, they often don't get sufficient financial compensation when that happens. Small businesses are often going under because they're not compensated when they lockdowns occur. And the other thing that Glenn is ignoring in his analysis is that it's just tunnel vision, narrowly focused on the United States, or perhaps other countries that handle the pandemic similarly to the United States, and you're not looking at what other countries are doing. But I mean, we didn't have a real lockdown in the United States in the first place. We did a totally half-assed job of it. We're like pretty pleased will you stay home, and maybe we'll give you a pittance to do so. And then somewhere around mid-May of last year, politicians and others all over the country were like, whoopee, we're down to 10,000 new cases a day. Time to open back up. So that's what they did. And we kind of plateaued. We never really You tamed the initial outbreak of the virus. You never got below about 10,000 new cases a day, and started creeping up over the summer last year, and then we headed into fall and winter, and it skyrocketed, and we had like 3,000 people a day dying at one point. And then vaccinations came into play, and that came down considerably. But then between the CDC's utterly foolish decision to say that vaccinated people could ditch their masks and just not bother with masks anymore, failing to take into account that vaccination works well, but is not perfect. So at least initially in the clinical trials, vaccines were reducing incidence of COVID infection, symptomatic infection, by between 70 and 95%, depending on the vaccine. But over time, the efficacy against that particular outcome creeps down. And then you're saying, vaccinated people, you can take off your mask, which of course exposes them to more virus, so breakthrough infections become more likely. And then you have the unvaccinated people who are like, well, nobody's checking whether I'm vaccinated or not. I'm going to ditch my mask too. And in fact, polls showed they abandoned their masks to a greater extent than vaccinated people did. And guess what, guys? Glenn Greenwald was very much in favor of that idiotic policy decision. And he bashed people who opposed the CDC's decision as opposing science, basically. Anyway, this provincial attitude and really lack of the deep knowledge of COVID policies around the world that Glenn exhibits leads him to really botch this attempted cost-benefit analysis, because he completely ignores other countries that handle the pandemic quite a bit better than the United States, and really, because they kept the virus in check so much better than the United States, they greatly improved the quality of life of their citizens, compared to folks here in the United States. So, let me just show you some. Let's see. Let me just show you a graphic of the policies that were undertaken in New Zealand for comparison purposes. Okay, so this is a study that was done comparing countries around the world in terms of the stringency of the policies they use for controlling the pandemic, ranging from school closures to workplace closures to travel bans or border closures, mask mandates, etc. So let's look here at New Zealand versus the United States. So back in the initial phase of the pandemic, everybody in the United States remembers this as this horrific time when we couldn't do anything and we, were shut down. Unless we were essential workers, we were kept in our homes. All the schools were closed. We could go into stores if we wore a mask, but there were a lot of restrictions on life. But compare U.S. COVID policy at that time to New Zealand's COVID policy. On this index, on a scale from 0 to 100 of how strict the policies were, New Zealand was up around 90. They were almost maxed out. Much more stringent than the United States. And you might think, well, how horrible. But look what happens after the first few months. The stringency of their measures declines to almost nothing by summer, their winter of 2020. Then they had like a regional lockdown a little later, you know, and then policy went back down to just relaxing all their measures. No masks, no anything. The schools were wide open, and except for a couple of blips, that continued until just recently when they had some cases pop up and they had to lock down again. But meanwhile, throughout this time, the United States has just had kind of a middling level of restrictions. Sometimes more, sometimes less. Sometimes the schools are open, sometimes they're closed. Sometimes there are mask mandates, or in some parts of the country there are mask mandates. Sometimes they're not. And then, once the vaccination campaign got rolling, many of those measures were dropped. But we were never as freed up as New Zealand was. So let's look in more detail at this. So New Zealand actually sent kids back to school, wide open, on May 18th of 2020, which is earlier than was the case for a lot of school districts here in the United States. And the reason they were able to do that is because they had locked down so tight that by that point, mid-May, only a couple of months after they initially locked down, there were already very few cases of COVID in New Zealand. Quite a contrast to the United States, where, as I said, we're getting 10,000 cases a day. Moreover, on June 8th, New Zealand lifted all COVID restrictions because they had had a period of more than 2 weeks where they had, and they were keeping very close track, they had no cases of COVID in the entire country. Now, granted, it's a small country, 5 million people, but still, if we had devoted the resources to testing and contact tracing and so forth here in the United States, on the scale that New Zealand did, we would have been able to do that too. And if we had enacted the same strict policies that New Zealand had, we could have done the same thing as New Zealand and, freed ourselves of the virus and, then lifted, all restrictions. Because I think I've showed you before. Let's see if I've got a picture here. Maybe not. Anyway, I've showed you before how in New Zealand they had the America's Cup races in March of this year with tens of thousands of spectators tightly packed together, including many of them visiting from other countries, the United States and Italy and the UK in the initial trials, and then Italy and Italy and New Zealand in the finals. So there were tens of thousands of international visitors in New Zealand, and they could afford to do that because they so tightly controlled cases, so that there were no cases within New Zealand itself, and you couldn't come in unless you tested negative for some period of time. And they were having concerts, they were dining indoors, they were doing all kinds of activities indoors, including kids going to school without masks for the vast majority of this pandemic. Something like 16 out of 18 months. Well, let me check the exact figures on that, but 15 or 16 months. Sorry. Okay, so the periods of time when they've had severe restrictions are very short, and you look here for the vast majority of the pandemic, they've had fewer restrictions on daily life than the United States. Essentially none, and the same's true in China. Um, in the interest of time, I won't go through all of that. But China did the same thing. If anything, they were even stricter than New Zealand, although New Zealand did very well. And so you had the same thing. China has been opened back up. People often do wear masks, but they haven't really had to for a long time. So you saw scenes, during the summer in China last summer, where people were, for example, having big parties at a water park, mask-free, very tightly packed together. Same thing for, trying to think here, Muslim holidays over the winter in Western China. No restrictions on people whatsoever. Tens of thousands of people gather together. This is what you're able to do if you control the pandemic. And so all those mental health consequences that Glenn is talking about of kids being isolated, which, they're not really as isolated as he claims, because, just because you're not in school doesn't mean you don't see your friends and so forth. But kids in China and New Zealand didn't have to worry about that for the vast majority of the pandemic. And also, I can't remember if I mentioned this before, but how can you be so sure that the consequences of COVID are consequences of lockdowns? The mental health consequences. What about other mental health consequences? Just the consequences of fear of getting seriously ill, or your parents getting seriously ill if you're a kid, or other people that you know and love being taken from you. There's more than 1 million families in this country, well over 1 million, who have experienced loss during this pandemic, at least of an extended family member, because 640,000 people have died. Well, I guess more than that now. I think we're up to about 650 now. Think of the mental health toll that takes on kids, Glenn. Did you think about that? No, you're busy worrying about kids missing school. And as I've talked about before, I'm a psychologist, a social psychologist, and I do research, or have been throughout the pandemic, on the role of culture in how both governments and individuals respond to the pandemic. And what you see in the United States is that even people on the left, which Glenn more or less is, even though he doesn't consistently take I mean, he's not as leftist as I am, I guess, is one example. But he's on the left, and yet he seems to have this huge fucking libertarian streak in him, where he is against um, people being required to wear masks if they're vaccinated, and he's against kids being kept home from school to control the spread of the pandemic. And just in general, there's this sort of very libertarian, individualistic attitude in the United States that doesn't seem to value controlling a deadly pandemic to the same extent as controlling, or excuse me, as being free to do what you want. So kids being free to go to school and hang out with their friends and learn from their teachers in person. And granted, that's important. Other things being equal, but he's ignoring all the consequences other than the rare possibility of kids dying from COVID of having in-person schools. He's ignoring the exponential growth of the virus, and that's why he picked such a poor analogy. Car crashes aren't contagious, and he's also really not taking into account the consequences to frontline workers, including healthcare professionals, of having this lack of the kind of anywhere even remotely approaching the kind of control of the pandemic of countries like China or New Zealand or some others, where we have hundreds of times per capita the number of COVID cases and deaths as the countries that have done best at controlling the pandemic. What does that do economically? Countries that have done well at controlling COVID are faring a lot better economically than the United States. China actually, their economy grew at a substantial rate last year. New Zealand had some loss of GDP, some negative growth, but they've come back this year in a way that the United States really has not. And Yuan is also overlooking, as I was getting ready to say before I got sidetracked, the risks to frontline workers such as nurses and grocery store workers and restaurant workers and so forth, of having an out of control pandemic. So many healthcare workers have lost their lives or gotten seriously ill from COVID and so forth and so on. And so intensive care wards right now are just completely overrun, and hospitals in general are completely overrun with COVID cases. If you have a heart attack, you may not be able to get a bed in the hospital. And part of the problem is that we're sending kids back to school, and the rate of cases is mushrooming because of that. So even if not very many kids are dying, a not inconsiderable number of kids are winding up in the hospital, or they're infecting other people who wind up in the hospital, and so forth and so on. We just the last few days have been over 1,000 deaths per day in the United States, more than 4 times the rate of earlier this summer, and that's just not taken into account in how he's looking at things here. I want to close out by because one thing that Glenn said in his remarks online about this was that he thought that the many people who were criticizing his point of view about this were taking that point of view because they didn't have kids themselves. And a lot of us were saying, hey, I have a kid, and I completely disagree with you, Glenn. And I just wanted to share with you what what's her name, Lisa Lisa Diaz had to say about this policy that her government there in the UK wanted to pursue of sending kids back to school. Here's where it is. All right. Let's see. I got this set up. Yes.
Good morning, my name's Lisa, I'm from Wigan. I've just got a couple more questions for Gavin Williamson, please. If you could answer these, Gavin, they're really important, and also one for Boris Johnson. The first one is regarding the latest advice that you're giving to school leaders to only get in touch and reach out for help when 10% of the population of their school, be it staff, students, whatever, are infected with COVID-19. Before then, don't come for help. If you could provide the scientific evidence and the modelling behind this this 10% number. Obviously it's really important because the children we're talking about here who we're letting the disease spread to. So yeah, where's this 10% come from, please? Because otherwise people might just think it's an arbitrary figure you've plucked out of the air, and we wouldn't want that. And then my other question is, I saw in tests that assemblies are being encouraged again. Can you explain why in a pandemic it's a good idea to shove a couple of hundred kids in a hall all together with no masks, no social distancing and inadequate ventilation? Why do you think that's a good idea? And my last question, please, is for the Prime Minister, Boris Johnson. And it's in regards to your old school, Mr Johnson. I'm just wondering whether the kids in Eton will be all packed 30 odd into a classroom without any masks, social distancing. Will they all be shoulder to shoulder without any adequate ventilation? Or is it just the plebs kids like mine that are going to be used in this hybrid immunity experiment?
So yeah, pointing out the class privilege of the people who are making these decisions, where their kids probably don't have to worry about any of this. They can send them to a private school where they have much smaller classes. They might have a mask mandate. They might not do in-person schooling. Who knows? But anyway, she's pointing out the lack of control that the working class has over the conditions in which their kids are sent back to school, and just how frightened so many parents are of this situation, where it's basically just a petri dish with so many kids unvaccinated. And actually, I meant to show you this video first, where she elaborates on exactly what the situation is. And Lisa actually was so worried because she has a serious health condition herself that could put her at great risk if she got COVID, even though she's only 40 years old. And she was so worried that she held her kids out of school at points last year when they were trying to mandate that kids return to school. And she was threatened with huge fines. She was threatened with being sent to prison, all of this stuff, because she was trying to keep her family safe. Anyway, let me play this video for you where she talks about just how terrible this situation is in UK schools.
I'm 40 years old and I'm from Wigan. I'm just making this very short video to express some of my concerns regarding the schools reopening and the lack of mitigations for COVID-19. So just as an example of the level of care I'm taking now, I'm meeting up with another mum with my two and her 3 kids. We've all done lateral flow tests before setting out. We are meeting outside, we're doing orienteering, and we're going to wear masks and keep our distance. So that's the level of care that I'm taking and the other mum's taking to protect our families. Now in a couple of weeks' time, I'll be expected to send the 2 people most important and precious to me in the whole wide world into a class with 30 odd other unvaccinated bodies, no masks, no social distancing, and inadequate ventilation, it'll be open a window if it doesn't, if it's not too cold. And it's not good enough. It's a myth that kids don't catch COVID. Jenny Harris said that a child is more likely to be hit by a bus than catch COVID. That was a lie. I know about 30 kids personally who've caught COVID. I don't know one who's been hit by a bus. That kids don't get severely ill with COVID is a lie. Over 1,100 children were admitted to hospital in this country in July alone, 5 of whom tragically died. So why are we just letting this virus rip amongst children? It's all the more infuriating that there's a vaccine available for over 12s, but they're not even letting us have that for our kids. It's just really appalling and depressing. And I desperately want my kids to be in school, but just like I wouldn't send them into a burning building, I'm not going to send them into a classroom that's highly conducive to the spread of COVID-19. So if there's anybody watching this in any kind of power, please call it out for what it is. We've got to protect our children. I don't see any controversy about that. We want them in school, but it has to be safe.
Yeah, and she's expressing the sentiments of many, many parents of school-aged children and many others who care about children and their families who are being put in this very dangerous situation with no alternative. They're being threatened with all sorts of negative consequences if they don't send their kids to school. They're not given an option of doing online schooling. In many cases, they're like no masks in the schools. They're crowded, poor ventilation, etc. And the UK and other countries that have adopted this policy of sending kids back to school when in many respects they're not taking measures to control the pandemic. They're just relying exclusively on the vaccines, which we don't have nearly enough. Not even in countries like the UK that are about 10% or more ahead of us in terms of the number of or percentage of their population that's vaccinated. That's not high enough to achieve herd immunity with a variant as contagious as the Delta variant. So it's been estimated by epidemiologists that in light of this greater contagion, it'll take something like 90% of the population being vaccinated, along with whatever immunity people get from having had COVID before, to achieve herd immunity with COVID. And we're just not going to get there. And as I said the other day, if we want to get out of this, we're going to have to follow the path of countries like New Zealand or China and some others, and you really lock down hard, have mask mandates in place when people do have to go indoors in public, for a few weeks, and pay people to stay home and take care of people while we're zeroing out COVID. Because if we just let it linger around, especially if we do things like have in-person schooling while there's a very high caseload, we're never going to get this under control. And we're going to have a higher likelihood of vaccine-resistant mutations occurring, the more we allow it to spread. Glenn is really not thinking long-term, when he's doing his so-called cost-benefit analysis that leaves out the vast majority of the costs associated with opening things up like he wants to do with regard to schools or anything else. Okay. I see I've gone longer than I meant to. Again, I'm sorry about that. But I'll close for now and see you next time.